No time like the present to make a video about women's health issues, because we're talking about Lindsay Clancy and we're talking about this postpartum psychosis that she was suffering from. At least that's the defense in her trial. So I did some research and I am going to share with you what I learned today. My job here is to both educate and entertain, so stick with me, but here's some of the research I did today. Now, this is according to the National Institute of Health's National Library of Medicine. This is where I got all this information. Let's start with this one. Up to 80% of new mothers experience the baby blues. This is short-lived weepiness and mood swings. Next degree up from that is postpartum depression. It is more severe and it persists longer. Postpartum depression affects approximately 1 in 7 women, which is about 10 to 15% of new mothers. Some specific demographic groups, such as Black and Latino women, can see higher rates. This impacts 460,000 new mothers every year, which is why I'm fucking baffled that we don't spend more time researching it. Postpartum psychosis, which is also PPP, affects about 2 out of every 1,000 women after childbirth. So this is 0.2%. It's a very small group of the population. It can begin very swiftly after delivery. So within the first 48 to 72 hours up to really the first few weeks. It escalates rapidly and can place the life of the mother and infant in danger due to its symptoms. Symptoms include seeing or hearing things that are not real, false beliefs, extreme mood swings, and confusion. A personal or family history of bipolar disorder greatly raises the risk, though it can happen to women who have no history of mental health issues. After experiencing postpartum psychosis, mothers have a 50 to 80% chance of another psychiatric episode, which is usually within the bipolar spectrum. Postpartum psychosis may be the first presentation of bipolar disorder. PPP delusions evolve more quickly and often center on infants. Dysphoric mania and cognitive symptoms include a delirium-like presentation, which usually begin suddenly the first few weeks postpartum. This condition, and I cannot stress this enough, this condition is a medical emergency and almost always needs immediate hospital care. Women with PPP may also exhibit symptoms that could be mistaken for just regular medical illnesses. This can include irritability, mood changes, confusion, disorientation, and insomnia, which is why there can be a misdiagnosis. Screening for PPP is difficult due to the range of presentation, the fluctuation over time, and the hidden nature of the disorder. Newer studies have reaffirmed previously known risk factors, including genetics, likely contribution of rapidly declining estrogen postpartum, and sleep deprivation. PPP is a medical emergency that requires immediate psychiatric hospitalization. The use of medications like antipsychotics and lithium, but also sometimes electroconvulsive therapy, which is called ECT, will help ensure safety and recovery. Most patients need a hospital stay to protect the mother and the baby. This also requires 24-hour monitoring. Constant care can help manage severe confusion, extreme mood shifts, and unsafe behaviors. Recognizing PPP. So this can be a couple of different things that you can do to recognize it. It can be characterized by mania and or agitation, with irritability much more common than elevated mood. It can be characterized by depression and or anxiety. Patients can be disorganized, disoriented, and have disturbed consciousness and catatonia. I think that's how you pronounce it. That's basically being in catatonic state, like the zombie stupor she claimed she was in. 72% had abnormal thought content, most often consisting of persecutory delusions and hallucinations. Now, the reason I wanted to do some of this research was because some of these things were things that Lindsay suffered through. When I talk about mania, right after her third child was born, She was waking up at 4 a.m. She was running 3 miles. She was doing 30 minutes of spin on her Peloton. Then she was doing 30 minutes of aerobics. Very definition of mania. Then she had bouts of extreme insomnia. She would only sleep 3 hours a night. In one case, after one medication, she was awake for 48 hours straight. On 3 different occasions, she told healthcare providers that she was feeling, that she was suffering from anxiety, that she was scared, that she was nervous, that there was something wrong with her. But the word anxiety kept coming up over and over again. She mentioned multiple occasions that she was hearing voices, that she was having hallucinations. I think what will help the defense is that 2 of these healthcare providers, 2 of the first ones that she went to, missed the signs and should have seen the flags for bipolar disorder and missed it. So she did not get diagnosed properly from the beginning. So thank you if you've come back to learn a little something tonight, and we will be back on Monday as we start the murder trial of Lindsay Clancy.